My name is Alan Blood. In 2011, I was diagnosed with stage 2B breast cancer. And again, in 2015, in the fall, I was re-diagnosed at stage 4 metastatic breast cancer. I was 38 years old when I was diagnosed with breast cancer for the first time, and that was stage 2B. I had an invasive ductal carcinoma, about 3.5 centimeters, on my right side. And it had spread and created a tumor in one of the lymph nodes in my in my right armpit. It was really a shock. I mean, I had a lump in my chest, and it didn't really hurt that much. It was there was some swelling around it, and but it was a really hard, kind of irregularly shaped mass under my skin, and it concerned me enough that cancer hadn't crossed my mind at that point, but my wife was a little more worried than I was at the time. And so we went in to see a general surgeon, and they did a lumpectomy, and he was concerned with the result, and he had sworn that there was no way it could be cancer because I'm a man, and we even asked him, you know, so what if it is cancer? He's like, well, it's most likely not. That would be extremely rare. And I said, what? And then my wife reiterated, well, what if it is? And then he turned around and smiled and said, well, we'll be famous if it is. I'm still waiting for that part. But after the mastectomy, which was really quite an ordeal, I met up with my oncologist, and we started the AC plus T standard regimen of chemotherapy, and lost my hair. And this was all in 2011. Before I received the chemotherapy, they had me go into a surgical procedure where they placed a port under my skin that went with a line directly into my heart, where they administer the chemotherapy. And it was a really interesting experience sitting in an infusion center and being the only guy being treated for breast cancer, and to be so young. But I made a lot of really good friends with some of the younger gals in there that were also being treated and that were finishing up their treatment. I got a lot of great tips, and my wife made some good friends through the process as well, and they were very supportive to her. The first 4 treatments were of 2 different drugs. One of them is known as the Red Devil, and it caused a lot of nausea and just disdain for food, and it was just a really, they really, and my oncologist warned me that they were giving me a dose-dense schedule, and that they really just wanted to nail it. And by the time I got to the last 4 treatments of Taxol, I was really wasted and lost all my hair, and all the hair on my body was gone, and I just felt like a completely different person. And so it was late in the spring of 2012 when I thought things were going into remission. My oncologist started me on daily hormone therapy. My breast cancer was hormone positive, meaning that the cancer cells had receptors for progesterone and estrogen, meaning that they consumed those hormones to survive. And so I took a medicine that blocked those off, and it caused, not a whole lot of data exists to show what happens when guys take something like tamoxifen, hormone therapy. And so it was an adjustment for a few months. I had to take some anti-anxiety medication, and it just hormonally, it just really, really blasted me. But for 3.5 years, I started getting used to it, and And then in the fall, actually it was September of 2015, we were at a local amusement park, and I hit the front of I had like a dry cough for weeks, and it was really obnoxious, and I thought it was just allergies. And then when I got on this roller coaster and it stopped abruptly and it slammed against my, the thing that goes over your head, it slammed against my chest, and I'm like, wow, that really hurt. And I felt like an abnormal protrusion on my chest, my sternum, of sensitive bone. And I'm like, wow, that just doesn't feel normal. And so I was a month behind on my regular checkup with my oncologist. So I figured, I better get in there. And he had me do a chest X-ray, and the results raised some red flags. He got me into a CT scan, and he noticed an area in my spine and in my chest and in my lungs where he was concerned that there might be some cancerous activity coming back. And of course this came as a shock, and he said, well, to make sure, let's get you in for a PET scan. And PET scans are probably like 10 times more expensive than a CT scan, but they're a lot more detailed. And they include a CT, but the PET part kind of shows the climate overlaid the top of your body, which is what the CT scan provides, a scan of your body. And so together they could composite them, and they could see which areas of my body would light up with high metabolic activity, which is indicative of cancerous activity. And so I came out of there, and before my oncologist could contact me with the results, I had already signed into the IHC, Intermountain Healthcare, patient portal, and pulled up the radiologist report. And I did this from home, and I about fell off my chair. It was 2.5 pages long, and it had spread everywhere that the PET could pretty much detect, except for my limbs. It was in my chest, it was in my spine, it was in my pelvis, it was in my hips, it was all over my lungs. It was on my breastbone, it was my ribs, and it was in the various lymph nodes around my thoracic and abdominal cavities. So it had come back with a vengeance. And a few weeks later after that, I had a brain MRI. You can't pick this stuff up on a PET scan for your brain because it all glows in your brain in those scans. So I had a brain MRI where they noticed that the results there were that there were more cancer nodules and lesions in my brain than they could count. And so they decided to do a full brain, 15 treatments of full brain radiation on my head. And they made the mask and everything to put on my head and bolt me down to a table. And I'm not really claustrophobic, but it kind of freaked me out. And it all happened so fast. I mean, since last September, I've been, they put me on Taxol again, which was the last chemo drug I had done the first time, but this time smaller doses more often. Because it's stage 4, the standard of care is to maintain quality of life because it can't be cured. The first time around, they nail you with as much as they can to try to just snuff it out. But this time around, it's more of a long-term marathon to just try to stay, alive as long as you can. And so I was able to get past 3 Taxol treatments before I had to stop that to do the brain radiation treatments. When I was done with that, I did one more Taxol treatment, and then I got pneumonia. And I had to be admitted to the ER, and I was intubated for a week in the ER. And I don't remember a whole lot of that. It took me a while for the memories of even being admitted and the visitors that came, and for those memories to come back. And when I came out of intubation and ventilation after 7 days up at Davis Hospital, I couldn't, it was difficult to breathe on my own. It was difficult to swallow food or drink, and I couldn't walk. And so what brought me out of the intubation, and they tried 4 times to bring me out, was the realization that the Taxol I had been taking had caused an allergic reaction in my lungs, and it had caused massive lung inflammation. My oncologist showed me two comparative CT scans. It showed me one was completely white out in my lungs, and it completely filled my lungs. And the one from the December prior, or it was just a few weeks before the intubation, was black. You know, lungs are supposed to appear black as an empty void in a CT scan. So it was really, my wife and I didn't discover until then just how close I was to departing. And I was in the hospital for a week after I came out of the ICU and out of intubation, before I went home on oxygen and a walker. And I felt like an old person. I felt like my body had been taken away. But the interesting thing is I felt positive at the same time. I felt like I had actually become stronger mentally. And I knew that if I could get through something like that I could survive. And I was overwhelmed with positive feelings, and I had a ton of support from the community, from my congregation at church, friends, family, and a local foundation called Anything for a Friend. And they're based in Davis County, and they're also good friends of mine. And some neighbors nominated me to become a recipient for their foundation, and we had a big event. This was a few weeks before I went into the hospital. But I made just all the friends and all the support from that really helped me during this time, and helped my family especially try to get through this horrible thing. And when I got home, I was able to get home, thankfully, a few weeks before Christmas. So I was able to be home with my family for Christmas. We got home and some people had set up lights in our yard, and it was just really wonderful. The support that we received was really touching. It made a huge difference. And sometimes that's the best thing people can do besides praying, is looking for opportunities to bring light into an otherwise very dark situation. And it made a big difference on my kids too. I have 4 kids. I don't know if you can see this from here, but okay. And one of our neighbors actually paid for us to get a family photo shoot done, and they put this book together, and so this is my primary core support crew right here, and they're just all wonderful. And they've had to grow up a lot faster in some ways than I would prefer, but it was really, it was just a week later that I had to go into the ER again because of what I thought was high blood pressure. It turns out I had multiple pulmonary embolisms in my lungs, just to add to everything else. And so I had to start injecting blood thinners into my stomach, with my abdomen, right around my belly button where the fatty tissue is there. And so I had to do that twice a day, and so I thought I had overcome a fear of needles, but injecting yourself is quite a bit different than somebody else doing it. You can look away. And so I'm still doing that. It's actually a pill now that I can take for blood thinning. Yeah, I got back onto a different chemotherapy. I was then on Ibrance chemotherapy with Femara, which is the new hormone therapy. It kept things at bay for just under 6 months. And during that time, the cancer started to spread. And one little tumor actually went down my left ureter and grew in the wall of my left ureter between my left kidney and my bladder, just above where it enters my bladder. And it caused, I had to go to the ER twice for what I thought were kidney stones. The first one was a kidney stone. The second one was a case of urinary, it was renal, they call it renal colic. It's where there's an obstruction in the ureter, so the urine backs up into the kidney and causes an extreme amount of pain. And so the doctor, the urologist that I was working with said, well, it's extremely rare for cancer, for tumors to go to the ureters. So we'll see what else it is. It turned out to be a tumor. So not only am I 1 in 1,000, I'm the 1 in 1,000 case for breast cancer for a man. But for a man my age to get it, I didn't like the word rare anymore because it didn't really seem to apply to me anymore. And so when he said there were, that one possible option was that it was a tumor, I knew immediately that it was a tumor. So he went in and did a retrograde ureteroscopy. So he goes up and sends a scope up there and identified that it was a hard tissue indicative of a metastatic tumor. And he put a stent in on my left side, which is still there. And sorry. So that, yeah, so I had an inflamed left kidney, and I'm like, oh, gee whiz, what next? Am I going to suffer from renal failure now? Am I going to have to go on dialysis? I mean, what is this? I got another kidney. And so I had to go on for 10 more radiation treatments, targeted radiation treatments, to try to zap the tumor that was growing in the wall of my left ureter and blocking it off. So, yeah, it was just one thing after another. I loved science in high school. I loved anatomy and learning about all this stuff. I never thought I'd be learning this much about the renal system, about the circulatory system, lymphatic system, the central nervous system. I just had a follow-up brain MRI, and the tumors the quantity of tumors is much less, and the ones that are still there are much, much smaller, so that's good news. But some of the cancer cells from the top part, from the cerebral spinal fluid in my brain, have drifted down through my spinal cord, down to the bottom of the spinal cord, and now have been interacting with the nerve trunks down there at the end of the spinal cord. So both of my legs are numb, and it's hard to walk sometimes. And if left untreated, we got another MRI done of my lower lumbar. The doctor ordered me right away on lumbar punctures and administration of a special chemotherapy to be injected through the spine into the spinal cord, which I've just done one treatment of, and so far it's been pretty effective. So I have 8 more treatments of that to go. At the same time, I'll be moving on to another oral chemotherapy to replace Ibrance, which wasn't working for me anymore. So I'll be starting that the 1st of July. And boy, it's just, you're waging battles on multiple fronts. And sometimes it's hard for people to tell, just looking from the outside, what you're dealing with. I'm battling issues in my renal system. I'm battling issues in my central nervous system. If left untreated, or if it doesn't work in 3 to 6 months, I could be paralyzed from the waist down. And so I really hope the next 8 treatments work. And then there's the cancer that continues to exist in the rest of my body that I hope the regular oral chemotherapy will take care of. So there's a lot to process, and still working full time and trying to support my family and my wife, is a lot of it's a lot of work, and I have become a lot stronger though throughout this whole ordeal, and I've learned that we can't do anything about yesterday, and we can't do anything about tomorrow, but we can seize the day, and we can do things today to make a difference and to fuel the the positivity and the optimism that we should have. And it started out being mostly a coping mechanism, the positivity and just, never giving up, never surrendering, sharing my story, and it turns out people that love you and people that care for you, they want to hear about what the adventure is like. They want to know what you're dealing with. And even some people who don't know you, I've gained a lot of followers on Facebook from support groups or whatever that just want to, follow my story. And everything that happens, we post on Facebook and we share with people, and we try to keep a positive, uplifting, excuse me, an uplifting air to the whole thing. Jennifer is my oldest daughter. I have 3 daughters and then a son. And Jenny is, she's 17 years old. She remembers very well what it was like for me to go through all of this the first time around in 2011 and 2012. And it almost seemed like she was still battle-hardened when she found out the second time. When I came out of intubation, she insisted on staying in the ICU overnight with me, knowing that I was probably going to wake up the next morning. And so she watched over me. She got me pillows. She adjusted pillows. I was still coming off of the sedation, and so I didn't recognize her as my daughter at first. I thought she was some sort of an intern or nurse assistant, or because she was so kind and she was so patient with me, and I wasn't very cordial. And I didn't realize at that point that I had been out for 7 days. And when I saw her, I didn't recognize her as my daughter, just as a nice young lady. And I finally asked her, as the sun kind of lit up the window in the ICU room, I could see her face more clearly. I said, "What is your name?" She's like, "Well, I'm Jenny." "Well, what's your last name?" "Blood. I'm your daughter." And I just started to cry because I didn't know. And my wife had been through so much trying to keep everybody together and deal with visitors that were coming into town, and some that were welcome, and others that were just random, or it was overwhelming. And Lindsay, my second daughter, she's actually taller than my first daughter, but there's Well, my kids get along really well together. I mean, they fight just like normal kids, but Lindsay is probably a bit more dramatic, and I think she's taking it. She took it harder, and it's been hard for her. She gets stressed out really easily, and she just feels bad, and she's worried about her. She's worried about her dad, just like everybody else. But she's a sweetheart, and she's very strong. My third daughter, Allison, she is 11. She's turning 12 in August. She was just dumbfounded. I mean, what does this all mean? She was so young before, and probably too young to really realize what was going on. And she started to get really depressed. She would kind of go into her little cave. She loves these little stuffed animal things called Webkins, and she always has one on her arm. And it became this inseparable thing. She has about 100 of them, and every day she would swap out for a new. They gave her permission at school to be able to carry one around at the elementary school. And the school, too, was very supportive. The community, everybody was very supportive. It was very great for the kids to see all the support that we were getting. That made a huge difference. Community support, school support, counselor support, friends and family, neighbors, and fellow churchgoers, and just people that we had known for a long time. My youngest boy was just terrified. He just started to cry. He didn't know what any of it meant. And when we sat him down and told him about the results of the PET scan, we just had to tell him that I was really sick and that the sickness probably wasn't ever going to go away. And he just broke down. And it took some time to be able to sit down with him, and I drew a picture of an outline of a person, and I kind of showed him with a red marker, where the sick parts were and what we'd have to do. And he's 8, so what can you say? He's dealing with it as best he can. He was 7 at the time, and Evan was he was much younger. He was 5 or 6, I think, the first time around, so he hardly remembered. But anyway, they're all different ages. They're in all different stages of life, and they're all dealing with it very differently. And so it's a challenge for my wife and I to address their needs, the needs that they have individually. We can't treat them all the same way. And so my wife, I think she naturally excels in the trenches of life. She's a warrior, and when I was in the sorry. Yeah. When I was in the hospital, I didn't want to cry. When I was in the hospital, and I just remember thinking, yeah, Michelle, can you just get these people out of here? I don't feel very good. I just want to rest. I can't breathe, and I'm so tired, and I hurt so bad. I don't know what's wrong. Can you just get them out of here? I just want to, and finally, my wife and I was overnight in the ER, or in the ICU. It was the first night they kept me over, and decided that I probably wasn't going to leave for quite a long time. They admitted me to a room in the ICU after the ER and everything, and the doctors, they were observing me pretty closely. There's a pulmonologist and a few other physicians in there, and it looked like chances were pretty good I would have to be put on a ventilator and intubated. And so they sedated me. They have to sedate you consciously, so that when they're intubating you and they're putting the breathing tube in and the feeding tube and the catheter and every orifice except for your ears has a tube going into it, and my wife was terrified because that ICU room turned into a war room. They started rolling in all this equipment, and it turned into a surgical center, what looked like just a crazy. And I get all this from my wife. I don't remember that part, but she was there when I was writhing around. Sorry, did I hit the microphone again? Anyway, I was apparently when they intubate you, they're putting the tube down into your lungs, into your windpipe. It feels like you're dying, but you don't remember it because it's conscious sedation, right? So later you forget that all that. And she stayed in the room as long as she could, but then just had to walk out and let them do what they do. And she actually debated with the physicians, with the pulmonologist, and they were insistent that I had to get on all of these antibiotics, and that it was a massive bacterial infection, and that my lungs, they had to start sucking all the stuff out of my lungs, and I guess it was really gross, and there was a lot of screaming and flailing, and they had to sedate me some more, and I hear about all this stuff afterwards, and my wife was able to take some pictures that are still kind of hard for me to look at, especially for her. And so she persisted with the doctors and tried to get them to consider using corticosteroids to reduce swelling, because she suspected it had to do with chemotherapy. And she asked them, well, have you guys actually contacted Ellen's oncologist? And from that point on, they had her participate in every morning stand-up for my case there at the ICU. They do a stand-up for every patient in the ICU. Everybody involved in the care for that day is involved, and my wife was involved in that circle. And they questioned her and got her opinion and contacted my doctor, Dr. Stinnett, and I don't know if I can say names in this interview, at the Utah Cancer Specialist, and he's absolutely phenomenal doctor. And he came in and he ordered immediately a CT scan. So while I was intubated, they unhooked me and everything. They brought me back and did a CT scan with contrast. And by contrast, I mean they inject the solution that overlays the CT scan itself. It shows the areas on my body where there's high metabolic activity. It's kind of a cheaper version of a PET scan, but it's still very effective. And so the conclusion from that is that they would finish off the antibiotics, because that was part of their standard protocol, and then get me on at first dexamethasone, but then prednisone, another corticosteroid. And about 3 or 4 days after that, I started to respond positively. And if it wouldn't have been for my warrior wife, Michelle, I'm not sure I would have made it. Did I experience much of a negative stigma or criticism as a result of being a male with breast cancer? I think my answer would probably be no. More of a lack of understanding. I think the closest that I got to that was just some guys just totally dismissed the idea. It just didn't, it just didn't process the idea that a man could get breast cancer, and which is really an old way of thinking. I mean, we're all mammals. We all have mammary glands. For males, they're typically not developed. For women, they are. I mean, that's really the only difference. That and the fundamental makeup of our hormones is different. But men also have estrogen as a byproduct of testosterone. Women have progesterone as a byproduct of estrogen. And so, if I understood that correctly, that's that's the way it is. And so it was a matter of me and my wife, and for us to become educated, so that we could be up to the task and battle this disease, but also so that we could help other people recognize the danger that also exists for men. It's typically more, the prognosis is typically worse for men, mostly because I think they don't recognize it until it's too late. Or if they do, they don't take it as seriously. Or they don't want to communicate, or they're embarrassed. I was never embarrassed. I always kind of thought of it as a novelty. I grew up in a home with 3 sisters, no brothers, and I had 3 daughters, and no sons, except for 8 years ago when I had my son. So I was really used to being around girls, and so I really didn't. It wasn't really a hit to my masculinity at all. Thankfully, that wasn't really an issue that I had to deal with. And if some guys didn't understand what was going on, I just show them the scar. Yeah, I don't feel like I was treated that differently. And what was especially great was all of the female patients that were battling the same disease. At first, I felt like I was kind of treading on their ground, but the reception that I received from those ladies was phenomenal. They accepted me into the Young Sister Survivors of Utah as the honorary guy with breast cancer, and they were very supportive. They even had me speak at one of their holiday dinners one year. It was 2012. It was the year I was recovering the first time, and I just made friends that I still keep in contact with and provide a lot of support. And when young gals chime in to the Facebook page, needing support or whatever, I'm able to help out and help their husbands out and their boyfriends, and help them understand what they're dealing with. So I feel like I'm in a really interesting situation to be able to help a lot of people. And I think that's one of the reasons why I'm still around, is because I think I'm supposed to be here to help support other people that are going through this. And it's very special to me, the opportunity. And if I could go back in time, I would do whatever I could to avoid all the cancer stuff. But like I said, you can't do anything about yesterday. You can only do what's best for today. And that's what I feel like I need to do. And my wife is right alongside me and doing the same thing. And it's just as hard for caregivers. It's just as hard for the spouse or the boyfriend or the girlfriend or whatever. It's just as hard for them to watch a loved one go through this and feel so powerless. Just your body. I mean, the cancer it's the body's cells that are mutated and just doing their own thing, and the body doesn't recognize that they're malignant, and so they just gobble up their neighbors, and they just grow. That's why they call it cancer, is because the tumors that form look like crabs, and the tendrils and the damage that they cause as they spread throughout the body is really dramatic and can be unseen for a lot of people, and cause a lot of pain and terror for people that are dealing with it. Something that's really, it's really hard for somebody who's not going through cancer to understand. your body turning on you like that. And, you know, unless your hair's falling out as a result of the treatment, or I've lost like 60 pounds since the beginning of 2015. You know, unless you have those dramatic outward changes, people just don't realize that there's really anything to do and anything wrong with you. Yeah, it can make you feel very isolated. It can make you feel very alone. Like you're fading slowly from the planet and from society. So it's very important to speak out. It's very important to communicate. It's very important to reach out, try to help people understand. It's super important, I think, especially for cancer patients, to be willing to talk. And even if nobody listens, just the act of talking is very therapeutic. So it was late August. It's the latter end of August of 2015. I was with my family, my kids and my wife, at a local amusement park called Lagoon here in Utah. And it was a beautiful sunny day, and I had been battling for a couple weeks at least a persistent dry cough, and it had gotten so bad that I started to get pains in my back. I pulled a muscle in my back from coughing so much. It just wasn't normal. But I tried to just weather through it and just try to push through it. And I really wanted to go and have some fun with my family. So by the end we were there all day. And by the end of the day, I finally went on the last ride. And it was a really jarring stop, you know, with the thing that goes over your head and over your shoulders, and then the thing that comes up here. And I just remember, you know, jolting forward and it pressing up against my chest, and just there was this really bad burning feeling in my chest bone. And and then I thought, oh, something snapped, and I looked at my wife. I said, you know what, I've got to get in and see. Got to get in and see Dr. Stinnett. I'm already almost a month past due on my visit. I wanted to believe that none of this would ever happen again. I wasn't quite at 6-month visits. I was at 4-month visits still. It had been 3.5 years, just about 3.5 years by that time. And so I got in there. He did the standard examination. He listened to my lungs. There was some concern, so he ordered a chest x-ray. I was at work when he told me the results of the chest x-ray the next day. And then it was shortly after that he ordered the CT scan. I was at work again when he called about that. I insisted that he call me and not call me in because I didn't want to wait to hear the results, and I told him I could take it. After he told me, I wasn't sure if I could take it. And then he ordered a PET scan up in Ogden, at the IHC in Ogden, McCady, and they were great up there. But when I came out of that and got the results, like I said, it was the beginning of a new adventure. This is my wife, Michelle, and this is Jenny. She's 17. And this is Lindsay. She's 14. Allison is 11. And Evan turned 8 in April. And they're all wonderful people. I wouldn't be able to survive without them. And And they put this, some friends of ours put this book together. Can you still see this? And one of the things I really liked about this photo shoot that they did is they had each one of my kids put a specialized, personalized message on this chalkboard, and then take a picture next to me, not having seen it yet. So it was a surprise for me for them to do that in the photo shoot. And I'll show you all 4 of them. Here, this is Lindsay's. My daddy can do anything. I don't know if you can see that. This is Allison right here. My daddy rocks. And he kind of disappeared behind his sign. But I love my dad. So this was a really special thing for us, and for so many friends to come together on our behalf and just really help us out and provide support. It made all the difference. And I'm not sure we would have survived as a family if it weren't for the community and friends and support.